The World Health Organization has declared MPOX a global health emergency. This one, they say, is more serious than the outbreak in 2022, with more than 14,000 cases reported in Africa this year. Those who are infected with MPOX can get a rash and symptoms similar to the flu. There's currently two variants circulating, Clade 1 and Clade 2. Clade 2 tends to be more mild, but can lead to death for some. It's the variant that's been circulating most in the last couple of years, including in Virginia. The Clade 1 has been circulating in Africa. It's seemingly much more contagious and a cause for worldwide concern, though Norfolk's health director says that it's not the new COVID.
COVID was something very different. It was airborne. We didn't know a lot about it, and we had no immunity to it. We had no vaccine. We had no treatment. It is a very different situation right now.
There is an MPOX vaccine, and the VDH recommends it for those at high risk. Since the first outbreak, 6 cases have been reported in our region, with the most in Northern Virginia. The number of people diagnosed with Alzheimer's disease is expected to rise over the next several decades. It's a concerning factor, with the disease being the 5th leading cause of death among people 65 and older back in 2021. But testing patients for Alzheimer's can be costly and difficult to do without a hospital setting. Kevin Uretsky takes a closer look at how the results of a new study are providing hope that blood tests can be used to more accurately and quickly diagnose patients.
When it comes to medical issues impacting health and wellness, doctors say early detection is key for people to get proper treatment faster. This also applies to diagnosing Alzheimer's disease. According to the Alzheimer's Association, nearly 7 million Americans are living with the disease, with a staggering 13 million expected to be affected by 2050. While traditional tests to check for signs of Alzheimer's already exist, neurologists point out several setbacks.
Those tests include cerebral spinal fluid tests, but that requires undergoing a spinal tap, or an amyloid PET scan, which requires a specialized brain scan.
The results of a recent study, however, could be a game changer. Researchers in Sweden gathered blood samples from more than 1,000 patients being evaluated for cognitive symptoms.
This test measures levels of tau and amyloid in the blood.
Scientists say the new blood tests were able to predict an Alzheimer's diagnosis with 88 to 92% accuracy among participants. Doctors say blood tests like these could be done in primary care clinics instead of a hospital setting.
With blood tests, I think that hundreds of thousands of people could be tested for Alzheimer's disease.
While the study needs to be replicated across more diverse populations, researchers are hopeful these new blood tests can offer more affordable and timely results in the future, so patients diagnosed with Alzheimer's can receive drugs more quickly to start slowing the impacts of the disease. Kevin Uretsky, Fox News.